welcome. This is our February Thrive Facebook Live event. We are so excited to be here with our family dentist, Dr. Debs, who's actually my cousin. Okay, here she is. I'm popping out. Send your chats in, send your comments, your questions. We are here to connect and chat and hopefully answer some questions for you. Take it away, Debs.
Alrighty, thanks, Danielle.
Thank you.
Good afternoon, everybody. My name is Dr. Debra Ferraiolo. I'm a general dentist, and I practice in Totowa, New Jersey. And I'm hoping my goal today is to be able to empower you with information so that this way you can care for your child's overall health or children's overall health. And I have some select topics that Danielle has asked me to speak about. If you have any questions about those topics or any others, if I can't answer them for you today, I'm more than happy to answer them for you in the future. So let's get started, all right? I'm going to focus on, Danielle asked me to focus on infants and toddlers as far as the care and kind of opening up their world to the dentist. I do have notes here. Forgive me, but I wanted to make sure I covered everything. So it's a perfect time to chat with you because February is Children's Dental Health Month. And so it's during this month especially, we like to make everybody aware of the importance of oral health care, all right? And today is the last day. So tooth decay, unfortunately, is the number one chronic childhood disease, which is very sad when you think of where we are and how we've advanced. So I do work hard with my patients to make sure that they do their best, both parents and the patients themselves, to minimize the risk of cavities and things like that. All right. And so the first place to start would be with good oral health care habits and routine visits with the dentist in order to prevent tooth decay. So one of the questions that I get asked often is, how old should my child be when they start with the dentist? And do you really go when you see the first tooth? And yes, you do start your appointments when the first tooth arrives, all right? Or the other rule of thumb is by the time your child is a year old, all right? That being said, I am a general dentist, but there are dentists who specialize in the care of children, adolescents, as well as patients with special needs. So typically in my practice, when a child reaches age 2.5, I encourage their parents to bring them with them to their appointments. So they start to get used to us, and we may give them a ride in the chair. I've had children as young as 2 be able to sit and let me do an exam on them and a cleaning. I've had others that, they're 4 or 5 before that happens. But yes, the American Academy of Pediatric Dentistry does advise, and the American Dental Association advises that once the first tooth is in place, or to set your goal that before their first birthday or by their first birthday, you have them seen. I would encourage you to talk to your own dentist. I'm assuming if you have concerns and you're caring about your child's oral health, you also have the same care and concern about your own oral health, and that you have a dental home. All right, so speak to your general dentist. They may, first of all, have advanced skills so that they be able to care for a really young child like an infant. Or if not, they may be able to give you a referral to a pedodontist, which is what the dentist who specializes in children's needs is called. You can also use as a source your pediatrician might be able to give you names, and also friends and family who are already have their children in a pedodontist's office. And otherwise, you may choose to have your general dentist care for them, and you can chat that out with them as to what age range they feel that their skills can support. All right. And it's nice for the children to have a dental home by the time early on. All right. But once the first tooth comes into the mouth, even before that, you should get the child comfortable with cleaning the mouth, all right? So you could use a soft cloth, or they sell the infant toothbrushes to be able to clean the mouth and the gums. Maybe bath time is a good time for you to do that, to get them started with caring for their oral health, all right? Again, as I mentioned, find them a dental home, all right? Whether it be with the pedodontist or with your general dentist, but get them settled in their dental home. Let's see. And I mentioned to, use referrals from friends and family. Your pediatrician and your general dentist probably has, like I have a pedodontist, that a few of them that I can refer my patients to, where I know they'll get great care. And also it's about caring for the parents too, right? And being able to address your attention, them being able to address their attention to your questions and needs. All right. I hope that today I'll kind of give you an idea as to, what you might ask questions about. You are an integral part of your child's healthcare team, and so whoever you see, whether it be general dentist or pedodontist, they should allow you to be part of that team and to ask the appropriate questions. So baby teeth, there's a tendency to think, oh, they're just baby teeth, so it really doesn't matter if they get cavities or they break or they fall on them or whatever, but they are very important. The primary teeth, as we call them, actually provide space for the adult teeth. They maintain it, all right? They help with development of the jaws. So they hold a very important place. So we really don't want them to get cavities or get to the point where the teeth would be recommended to be extracted, and then you have to worry about space maintainers and things like that. They can impact the loss of these teeth or infections around them can impact your child's ability to be able to eat, impact their quality of life, go to school, and things of that nature. All right. I do have a little checklist, which I will be happy to share with Danielle so she can post for you and you can reference. And I'll also post some links for you. The American Academy of, the ADA, American Dental Association, and the Academy of Pediatric Dentistry has some wonderful information sites for parents. So I encourage you to take a look at them. All right. All right. So, and even if your child is older than a year and they're 2 or 3 and you haven't gotten them to the dentist, that doesn't mean that you should, not do it now. All right. Parents are very busy. There's a lot on your plate, a lot of things to schedule when caring for your children. So, just set it as a goal for this year to get your child settled in a dental home, whether it be with the general dentist or the pedodontist. And you can help at home with getting your child ready for, the first visit, right? Which comes with a little bit of anxiety on the parent's part and sometimes quite a bit of anxiety on the child's part. There's some great books out there that you can read to your child to get them oriented towards seeing the dentist. There's, some toys, things that they can play with to get them oriented toward visiting the dentist. So I, encourage you to do that. Read to them. Your pediatric dentist, once you've been there, might actually suggest. I found some great books for Danielle's little one who most recently had her first dental visit, and they enjoyed reading it together beforehand, and it got her motivated and comfortable. When you're in the dental office, allow the dentist to start to build their bond with your child. I'll say give center stage to the dentist, but most of the talking is so that they can build a bond. All right, you should always be able to discuss with the dentist any treatments that are being recommended. There's no limitations, just maybe not with your child in the room. I'll leave that to the dentist and what their comfort zone is. All right. And some people will ask, when should I expect the first tooth to arrive? And so they usually arrive typically between 6 and 10 months. Usually the 2 front teeth on the bottom jaw first, and then the front teeth on the top jaw will arrive. But everybody is different, just like in watching your child grow, right? Everybody develops at different stages and times. So if your child doesn't fall into that exact, time frame, don't think something terrible is going on. I would just then again find the dental home and have the dentist assess. They just grow at different rates and times. So. Let's see, and just also too, like I have some patients when they come in, the child is 4 and they're quote unquote brushing their teeth on their own. You really should plan on supervising your child's brushing up until they're at least 7 or 8 years old. There's hand-eye coordination. The length of time they might spend might not be appropriate, so that's something for you to discuss with your dentist also. So next I want to talk a little bit about nutrition and the diet, all right? And so just like anything else, make sure your child has a balanced diet, which is good for general health and growth and development. I'm going to say limit the amount of really sugary drinks or sugars and starches that are served to them, especially like soda and juice that can have potential to erode the teeth. That being said, that doesn't mean your child should never have any of those items I just mentioned. It's more about how long they spend. I call it grazing on them, right? So having a sippy cup loaded with juice sitting at their side and they're sipping it for hours and hours is probably not the best thing for them. All right. And if you're going to serve things that are drinks that are high in sugar, or even soda, it's not just the sugar content, it's also the acid content of the fluid. Try to do it when they're having a meal. Kids are kids. They're not going to be perfect. We adults are not perfect, right? So I think the rule that everything in moderation is okay. That doesn't, there's no reason that your child can't enjoy a chocolate candy bar, but more along the lines that either, get them to finish it between, 15, 20 minutes if it's a snack, or to enjoy these sugary beverages and items while they're sitting to a meal, all right? More saliva is produced, and so it acts as a buffer and it minimizes the acid content of things, all right? Sports drinks can be a challenge when your kids get older. I've seen quite a few kids wind up with cavities because that's all they were drinking. And again, it's about the length of time and the fact that you're constantly exposing your teeth to the sugars or the acids. Water's best, but that doesn't mean there aren't occasions where your child can and should enjoy some of these items, right? Sticky chocolate is better, but sticky chocolate with caramel and nugget and all that kind of stuff, it tends to stick to teeth. So hence it would have more of an impact and an increased risk of cavities. That doesn't mean again that you can't allow your child to enjoy it. The fruit pouches that I see kids kind of drinking or consuming, fresh fruit would be better. But again, a fruit pouch here and there, I realize, life is hectic and that makes things a lot easier. So that means never. It doesn't mean never. It means just be thoughtful as to how often, all right? And salty snacks like potato chips versus crackers and pretzels. Potato chips tend to stick in the grooves of our teeth. So that's something for consideration, all right? Needless to say, brushing, flossing, drinking fluoridated water. So not all of our water, most of our water in New Jersey is not fluoridated. So that's a conversation to have with your pediatrician or the pediatric dentist or the general dentist as to whether supplements are needed. If you use bottled water, you'd have to find out from the company what level of fluoride is present, because that's how they'll gauge what the dose of fluoride would be. All right, but important, just like for you, to have your child brush their teeth twice a day. If flossing is something that they will do, they have to be probably age 10 or 11 before they can manage that on their own. Most of the time with baby teeth, there's spaces between them, right? So it makes it easier for the toothbrush to get in there and clean. Let's talk a little bit about teething, which I'm sure is not a favorite time for parents. Your baby has 20 primary teeth or baby teeth, right? And they're sitting below the gum line. They, like I mentioned, they typically will come in between the ages of 6 months to 12 months. And usually by the age 3, they'll have their full complement of baby teeth. All right. Danielle asked me to speak a little bit about the symptoms that go with it. So normal would be fussiness, being cranky, trouble sleeping, irritable, maybe not wanting to eat, and more drooling. Fever, diarrhea, rash, anything other than that is not part of the norm for teething, so it may be something else brewing. So if that's the case, then you should reach out to your pediatrician and chat with them. So how do we deal with those times when the child is teething, they're crying? Again, not easy. So I have some suggestions for you, and maybe you might have some suggestions that you can offer up to on the chat on this stream, so that this way you can share what has worked with you with the rest of the people listening here. Your child's gums are going to be sore. If any of you remember when your third molars or wisdom teeth came in, there were times when it might not have been so pleasant. So picture that's happening on a pretty routine basis for your child. You might find that gently rubbing their gums with either a clean finger, a cold spoon, so that this way it kind of numbs the gum a little bit, or a moist gauze pad, moistened with water. Cold water would be helpful. All right. They sell teethers out there, all right, and that is helpful for the child to chew on. Make sure you're selective about the teethers that you purchase. They should be made of solid rubber. Avoid ones that are filled with liquid that you either pop in the freezer, or plastic objects that could break. Be very aware of what they're made from. Some of the chemicals and things that are in there can be an issue. And even if they supposedly call them homeopathic or holistic types, be cautious. Okay, so let's talk a little bit about pacifiers, because they're helpful when the little ones are teething, all right? And pacifiers are not a bad thing. I think they got a bad rap, when people see a child with a pacifier. But they work great to calm your child when they're upset or bothered about things, or maybe they're teething, all right? So offer to your child when when they need to be soothed or calmed, all right? But it's not meant to be used 24/7. On the American Pediatric Dentistry website, it recommends no longer than 6 hours a day, all right, give or take. But they prefer that you use a pacifier as opposed to a child starting to suck their thumb, because the sucking your thumb habit is a harder one to break. Pacifiers can be used as a distraction or to relieve pain if your child is undergoing a minor procedure. It's offered at the onset of sleep. So I actually, when I was researching for my presentation today, see that there has been some evidence. It's in regard to using that, and they're seeing less incidents of SIDS. I would ask you to talk to your pediatrician about that. And again, this is between the ages of 0 and 6 months, all right? You should avoid the pacifier if you're still breastfeeding, or until your breastfeeding is well established. And you can use it, it's perfect for when you're weaning the child off of breastfeeding. The big conversation about pacifiers and tooth position and, poor bites and things of that nature comes from more so if they're using it certainly after age 4, but somewhere between age 2, you can start to see the downside to using a pacifier. But by age 4, if your child is still using a pacifier, then the goal would be you probably should get your dentist or pedodontist to help you with how to discourage it, all right? Excuse me. In the second 6 months of life, which would be ages 6 to 12, there has been some of what I saw was a decreased risk of ear infections. All right. Again, talk to your pedodontist, because that's out of my realm. But I thought it was worthy of a statement, because we have lots of kids that wind up with ear infections, and that's not a pleasant thing for your child or for you in caring for them. As far as selecting a pacifier, so always look to make sure that it is an orthodontic pacifier, all right? There's lots of great companies out there. Nook comes to mind, but there's other ones. As long as it says it's an orthodontic pacifier. They're specially designed to minimize misalignment. They tend to be flatter as opposed to round, all right? And it helps to support development of the developing jaw and the palate, which is extremely helpful, all right? The traditional round pacifiers, increase the risk of an open bite, overbite, and things like that. So just look to see that it's an orthodontic pacifier, all right? And many of you are thankful that there is the invention of the pacifier because it calms and soothes our babies when they're, fussy and uncomfortable. All right. But again, the pedodontists recommend pacifier over thumb sucking, hands down. All right, because it's easier to break at an early age. All right, and as I explained, it's important. The sucking reflex is very important. It acts as part of the jaw development, teeth position, things like that. All right. But what you don't want is for the teeth on the top jaw to wind up tipping outward or having poor alignment of the jaw. All right. So if your child reaches age 3 and you're still having a difficult time weaning them off of it, then I would suggest that you, seek out professional help, which would be in your dental home. All right. And there's lots of different techniques on how to, people say, oh, well, they just won't give up their binky, right? And so some parents do it cold turkey. I'm not sure what the repercussions are for the first couple of days on that one. But others do it gradually, all right? And so I'll post these also. There's some techniques that you might want to consider if you're at that point where you need to, you're looking to have your child wean off of it. You can talk to your dentist, right? Whether it be the pediatric dentist or your general dentist, and see what suggestions, all right? Depending on how old your child is, usually at age 3, you probably could start with like some type of a reward system, or for an alternative, all right? If they, if they're looking for their pacifier and replace it with something else that gives them comfort or reassurance, because that's what the pacifier is doing for them, all right? Distract them with a fun activity. Be sure to offer positive reinforcement when you're taking it, and praise them for when they've, given up the binky. And, you might need to get creative. I've had some people put a really creative spin on things. You can take them to the store to pick up a new toy that's going to replace the pacifier, all right? And you might be able to get the store clerk to kind of play along with things, with this path. Some people have actually thrown a goodbye binky party, and you might find success with that, or that the binky fairy is going to have the visit and will take good care of the binky, all right? Or that it got donated, depending again how old your child is and what they're able to understand. All right, the biggest issue with the pacifier is your timing. And so whether it be cold turkey or you decide to just make sure it's at the right time, okay? It's not during a time when either the child's going through some life changes, major transitions, traveling, where they're already being stressed, and now you're going to add to the stress. If you plan on ditching the pacifier, make sure everybody who cares for your child is on board, because all the work you might do during the time you're with your child, if the other caregivers hand them the pacifier, then you're really just digging your heels in the sand, all right? Let your child use the pacifier for short periods of time, where you feel that he really particularly needs it, and gradually lessen the frequency, all right? If you do go cold turkey, make sure you collect all the pacifiers in the house, because they might pop up not at the right time, all right? And as I said, you can chat with your dental home, the dentist that's caring for your child, to get some other tips. One of the things that I did was I've done this where I make a calendar for the patients. These are the ones that are probably age 3 or 4, where they're able to understand. And, if they get to the end of the day and they haven't used the pacifier, there's, a small treat, whether it be a sticker or something along those lines. And really, it takes about 21 to 22 days to break a habit. So when they get to the end of the month, if they succeeded, then you and your child could have settled on something that, whether it be a trip to the store, a trip to, whatever is fun for them, you can chat that out with them before you start the calendar. Okay, so I hope I've touched on some topics that were important. I'm open to any questions that you might have. And again, if I don't have the answers, I'll be happy to get back to you. Danielle, okay.
That came in, how do you stop finger sucking? And I see this all the time with kids just shoving hands in mouths.
Yeah.
How do we stop that?
So probably I would suggest that you could do the binky if they still have a pacifier around. And the other thing, I had really good success with the finger sucking by using a calendar and a reward system. And again, we're talking about children that are already age 3 and 4. I don't think that earlier than that, by age 2, you start to try and remove the binky.
I've heard of nail polish that tastes gross.
Oh, yeah, no, I wouldn't do that. No, I wouldn't do that. I wouldn't like that if somebody did that to me.
Yeah. Any suggestions on how to get a toddler to want to brush her teeth?
So, I'm going to tell you what I do here in my practice. Find whatever motivates them. I also don't like to overwhelm patients, and that includes my adult patients. There's adult patients that don't like to brush their teeth. And if I hand you a whole list of things that you need to do, including flossing and this and that, you're going to say, are you kidding me, right? So maybe start out with short bursts of, and make it fun. Figure out something that they like to do. Do they have to do it in the bathroom? I don't know. Probably not.
Backyard.
In the backyard, yeah, wherever you can motivate them. And again, everybody does it at different time frames. So I think if you start off early on with what I was mentioning, as far as, even before the teeth come in, using whether it be a wet gauze or something, get them used to that. And I understand that's really young, but they're getting used to the texture and something, brushing and moving inside their mouth. So